Colleagues, I welcome you to the webinar, Leveraging South-South and Triangular Cooperation in Advancing Child and Adolescent Mental Health in the context of COVID-19. I welcome you all very dearly to what I am sure will be a very fascinating exchange. As you know, mental health is one of the most neglected areas of the SDGs in reference to good health and well-being. And COVID-19 made this worse, making the provision of mental health and psychosocial support services an urgent priority for all populations, especially vulnerable groups. And this affects children, young people, and their families. Governments with their partners are implementing different approaches, covering different policies, programs, and a range of services to mainstream support to mental health. Much can be learned from each other, including through South-South and triangular cooperation amongst countries, which could scale up good practices and increase access to technical assistance and catalytic resources. This webinar is co-organized by the World Health Organization, by PAHO, the Pan American Health Organization, and the International Policy Center for Inclusive Growth. And it is part of a series showcasing solutions and experiences in countries of different areas of the SDGs in the context of COVID-19. UNICEF supports South-South and triangular cooperation, especially in the areas of education, nutrition, and response to COVID-19. We will have a very exciting panel today, and we will have first an initial presentation of 10 minutes by Dr. Batul Fatima, the technical officer of the Department of Mental Health and Substance Use from WHO, and he will provide the context. And after that, we will hear 3 country cases, very specifically addressing these issues from Iran, Argentina, and China, respectively. I will be introducing the speakers as we get to that moment, and that each one of these case studies will run for 15 minutes. And at the end, Dr. Hennis, the director of Department of ND of Non-Communicable Diseases and Mental Health from PAHO, will make some concluding remarks, wrapping up our discussion. So I will be your moderator for the session. My name is Andres Franco. I am the Deputy Director for the Public Partnerships Division. I lead on all the multilateral engagements and partnerships, and the South-South Cooperation Portfolio and Triangular Cooperation Portfolio with my colleague Marta and Jiwa, who are connected today, are part of the portfolio that I'm accountable for in UNICEF. So I welcome you very much. Just make sure that if you have any questions during the session, that you place these in the question and answer session, and we will address them as we go. So I think we're ready to go. And just so that you know, the interpretation, you can click on the icon interpretation for a specific interpretation in Spanish and in Chinese and some segments of the webinar. So I think we should go ahead with our first speaker. This is Dr. Batul Fatima from the Department of Mental Health and Substance Use from the WHO. Her resume is there, and I think we have in her a great asset to bring to us the right context for this discussion. So Dr. Fatima, I'm going to give you the floor to launch the discussion. Go ahead, Dr. Fatima.
Thank you, Dr. Andre Franco. And good morning, good evening, good afternoon, everyone. It's nice talking to you all. So today I'm going to talk about child and adolescent mental health situation in the context of COVID-19 response and some recommendations. Next slide, please. So we all know that a lot of mental health conditions start quite early at the age of 14, before the age of 14, 50% of the mental health condition start, and 3/3 of the mental health disorders or problems start by the age of 24. And this all starts very early in their life. So the children, the age of childhood and the adolescence is really a critical time when we can support children to have healthy mental health, and we can prevent a lot of mental health conditions from developing. The COVID-19 has really affected everyone, but when it comes to children and adolescents, it has really badly hit them with curtailed education. We know for long schools, colleges, and universities have been closed, diminished job prospects for the young adolescents, and reduced social contacts with their peers. And the data suggests that 1.58 billion learners, which is over 90% of the world student population, is affected by national closures. 40.4% of the youth have a tendency to have psychological problems during COVID-19, which is also shown by recent data. Next slide, please. Further data that has been collected and shows us that it has really increased a lot of fear and anxiety in children and adolescents. As children were afraid that if they go back to school, there will still be virus and infection around. 44% felt that they only, they don't have much information about it, and only 1/3 were able to correctly know how COVID is spread. 38% felt that worst situation is still yet to come. So there is a lot of fear and anxiety. And this fear and anxiety is affecting them in many ways. As we see in the graph on the right hand, children are feeling lonely because of not being able to meet with their peers. They are feeling nervous, they are feeling restless, they are feeling irritable, and they have difficulty in concentrating. Next slide, please. And when we asked young people directly as to what concerns them most about this ongoing pandemic, they had concerns about physical health and housing and education and everything. But most important thing which they highlighted was their mental health. They themselves reported that they were most concerned about their own mental health. Next slide, please. So this is the situation, and what will happen if we don't do anything? The consequences of not taking action are really huge. We already know that the global economic burden of non-communicable diseases are huge. So 35% of the burden is because of mental health. So if we don't take action right now, if we don't support children and adolescents, we expect reduced learning capacity, and future work disability, future lost in earnings, time off work, reduced productivity, both in studies and working. We know that suicide rates in people with depression and anxiety is higher, so we can lose lives, and further psychological hardship and career burden. Burden on health sector due to increased healthcare, cost of physical and mental health care, increased cost of social welfare and disability cost. And we know that young people with the mental health issues are 8 times more likely to have contact with criminal and justice services. So not only is increased service costs, but also likelihood of children getting involved into trouble for various reasons. Next slide, please. So what we need to do is mental health for all. We need to ensure greater investment, greater access for everyone and everywhere. we need to ask what we are doing to support young people. We need to make investment to change challenges into opportunity, because we know that there is a high cost of not taking action, and we need to, and we know that return on investment for every $7.5 is for every dollar spent. So if we spend $1, we get the return of $7.5. I'm turning off my video because I'm hearing that the audio is not very great, might be due to internet issues. Next slide, please. So when we hear voices of young people, people tell what they are going through and what they want. So children tell us that I'm sick and tired of having to wish them to understand anything, to stop cutting funding. And they're talking about funding from mental health, which is, they're asking for further investment in mental health. Children are saying that I wish they understood how important mental health is during and after this time. So not just during this time, but we need to continue supporting our young people all the way. Next slide, please.
You have 5 minutes, Dr. Fatima.
Yeah, that's why I'm not reading all the comments. So there are a lot of comments that we know. So we have a lot of resources for children and adolescents that we have developed from WHO and in partnership with UNICEF that can be used by, and it's currently used heavily by our partners and member states. So we have resources like Doing What Matters in Time of Stress. It's an illustrated guide which has even audios of relaxations available, very helpful for young people and adolescents. We have question and answers for adolescents, youth and young people. We have fact sheets, small tip sheets. My Hero is You is a very popular story, which has been translated almost like every country in the world, like almost many countries in the world. It's available in Braille, it's available in digital, it's available in video format. So it has been widely used. And we have many guidelines also available. Next slide, please. So we have provided framework for reopening schools so that schools can be made safe and secure for the young children. We have provided tip sheets and guidelines for the parents and teachers, how they can support children, and it's how children can be protected. Thanks. Next slide, please. We are also developing EASE, which is Early Adolescent Skills for Emotions. Target population is young adolescents 10 to 14 years, and it is for children who are highly distressed and have some impaired functioning. This can be used by caregivers, and it's a community-based manualized psychosocial intervention, and trained and supervised non-specialists can use it over a weekly sessions. And it has been, it's been currently tested in Jordan, Lebanon, Pakistan, and Tanzania, and will soon be available for wider use for other countries as well. Next slide, please. We are also developing STARS, which is Sustainable Technology for Adolescents to Reduce Stress. So this is technology-based. Artificial intelligence has been used. So adolescents, young children can use it by themselves. They don't have to go anywhere. It will be available easily on their palms. So that's the effort, so that in countries where there are not many service providers available, internet is available, so young people and adolescents can use it. Next slide, please. WHO and UNICEF has recently developed and provided HAT products, which includes guidelines on mental health promotive and preventive interventions, HAT toolkit, a teacher's guide, and a story, Magnificent Me and Friends, which is the first comic, and there will be further comics coming up, which can be used by teachers in their schools. Very easy to use, comics based. It's very interesting. Next slide, please. So the strategies mentioned in the helping toolkit actually works around all the various factors around individual, family, community, and societies, and provides guidance for countries and people working on it to implement and enforcement policies and laws, provide environment to promote and protect adolescent mental health, provide caregiver support and adolescent psychosocial interventions to enhance programming for adolescent mental health promotion and protection. So this is a very useful Adolescent 5 toolkit, which I would suggest countries to look at and use it for to help the prevention and promotion and reducing the risk factors for children and adolescents. Next slide, please. So these are a few resources, but I would really encourage you to look at our website, both UNICEF and WHO websites. We have tons of resources available, and we are continuously engaging with young people and developing further products, further comic guides. So within this brief time period, I can only share these in brief. We'll be happy to take questions and share further about these things. Thank you for your efforts that you are making. Thanks, everyone.
Thank you so much for that presentation. There was a little buzz in your mic, but I think we could follow your key messages very well. So we will get back to you later in the question and answer session. So thank you very much. I think this really provides a fantastic context for our first presentation. So now we're going to travel to Iran. And I'm really pleased to introduce to you Dr. Amahab Hajabi. He has been acting as the Director General of the Department for Mental Health and Substance Abuse in the Ministry of Health since 2013 and has a very, very outstanding trajectory in these issues. So we are really eager to hear from you, Dr. Hajabi. You have the floor.
Thank you. Hello, everyone. In this session, I would like to introduce some of the activities of the Mental Health Department for Children and Adolescents in Ministry of Health in Iran. Basically, the maintenance and promotion of the mental health of children and adolescents has always been considered as one of the main field of work in the Department for Mental Health. This department has always been performing various activities in this field. The COVID-19 pandemic, which started in March 2020, highlighted the necessity of paying attention to this issue. Evidence shows that children and adolescents in emergency situations such as this pandemic are more vulnerable regarding mental health issues. A few activities have been designed in our department and have been integrated in primary healthcare system. These programs are routinely reviewed and sometimes redesigned according to the emerging needs of the target groups. For instance, parenting skills training program for parents of children and adolescents, life skills training program tailored to target age group, program for prevention and management of child maltreatment, which has been integrated in the primary healthcare system. And we have also implemented some activities in collaboration with other sectors of Ministry of Health and other governmental organizations such as the Ministry of Education. One of these programs is the school mental health program. In this program, we are trying to promote and maintain the mental health of students in school settings. Parenting, please next slide. Parenting skills training program are the group of activities that strengthening the existing parenting abilities and promote the development of new competencies so that parents have the knowledge and skills needed to carry out child rearing responsibilities and provide their children with experiences and opportunity that promote child learning. In our system, this group of interventions consists of parenting skills training for children 2 to 12 years old, parenting skills for adolescents 12 to 17 years old, parenting skills training for high-risk adolescents aged 12 to 17 years old, and parenting counseling in the COVID-19 pandemic situation. As you know, the COVID-19 pandemic led to an increase in the times that children spend at home with their parents. This poses a risk for more conflicts or problems between them, and in this program we aim to enhance the skills of parents for the management of emotional and behavioral reactions of children and adolescents. In this program, the counselor tries to create a positive relationship with parents and assess the reasons for attendance, and then offer counseling and recommendation, and if needed, the counselors refer the cases to emergency settings. Please, next slide. Life skills training programs are another group of activities that seek to build capacity of individuals to make decisions and take actions that positively impact their lives and their lives of those around them. In our field, these programs include life skills training for children 6 to 12 years old, life skills training for adolescents 13 to 18 years, and behavioral counseling for lowering risk in adolescents. The last program in this slide, I mean behavioral counseling for lowering risk in adolescents, has some objectives such as screening and detection of risky behaviors, determining different level of risk, and preventing of risky behavior in vulnerable adolescents, and finally eliminating of risky behavior in adolescents. Please next. Child maltreatment prevention is another program which has been integrated in primary healthcare system, and the main activities performed in this program are initial screening of all children who are receiving the routine healthcare services, such as vaccination, and if the initial assessment be positive, the complementary screening for child maltreatment is being done by the mental health staff. In our system, the mental health staff is a clinical psychologist with a master's degree. Other interventions include providing psychological services for families, providing medical services for traumatized children if needed, assessment of the parents by the general practitioners for any possible mental disorders, and also providing medical treatment in case of diagnosis of any psychiatric disorders. Please next. The Esco mental health program is another intervention. 1 year prior to the beginning of the COVID-19 pandemic, a joint program was designed between the Ministry of Health and the Ministry of Education with the primary objective of maintaining and promoting the mental health of students in school setting. In this pilot program, the main target was increasing teachers' knowledge on psychological aspects of child development. And also, we try to improve the identification of mental health problems among students and differentiate them from normal range behavior, and effective initial intervention for a variety of mental health problems, with emphasis on preventing incurrent interventions by teachers. and referral of cases with psychiatric disorders for specialized interventions and identifications of emergencies such as suicide among school children. Until here, I have given a brief presentation about the activities related to mental health of children and adolescents in the previous slide. And now, I wanted to point out two of the challenges we faced during the COVID-19 pandemic. One of the main challenges was the temporary cessation of some of the integrated mental health program related to children and adolescents, and the other challenge was related to the school mental health pilot program. Regarding the integrated mental health programs, we faced the following challenges, such as in the health system, parents, children, and adolescents who were the target group of these programs did not go to health centers due to anxiety and worry caused by the virus. Training services, which were mainly group training sessions, were either not held or the frequency of sessions was significantly reduced. The routine established method of service delivery has been somewhat disrupted. Next, please.
Dr. Hajabi, you have 5 minutes. Please continue.
We designed some activities to overcome these challenges. For example, various training packages were developed for capacity building among the mental health staff in the primary health care system to provide psychosocial support for the general population. And in this way, needs of children and adolescents and also their parents in the COVID-19 pandemic were considered as one of the main issues in this regard. The 4030 helpline, a 4-digit helpline, was launched to provide remote counseling services for approaching the mental health needs of target groups. After the establishment of the helpline, parent could receive remote counseling regarding the mental health of their child, such as dealing with anxiety or behavioral problems, for getting over the challenges that the COVID-19 pandemic brought about, and for facilitating the capacity building and also easy access to of target groups to training sessions. We focus on the new method of training. In the new training model, the mental health staff who are target group for capacity building is trained using online platform and multimedia tools. On the other hand, the parents, children, and adolescents also receive the educational services with the use of a variety of multimedia packages such as short films, motion graphic clips, and animations. Next, please. Changing the model of capacity building and service provision has been started recently, but we predict after the complete establishment of these models, it means facilitating public access of the target groups to the multimedia package. We will have some achievements such as the level of service coverage will increase significantly, quality of training will be enhanced, because in the traditional method, face-to-face training and holding TOT workshop for training service provider had led to decreased quality of training and some endpoint of training. And a service recipient in these new methods can have access to learning packages at any time convenient for them, without having to attend the health centers again and again. The need for booster training sessions will decrease to a great extent. And in addition, we guess multimedia training packages be more attractive and possibly have the ability to capture more audience. The situation in the, please next. The situation in the context of COVID-19 led to problem in providing services in the school mental health pilot project. Other than that, the elimination of the school environment also led to negative impacts in the children's mental health and behavior. Therefore, we faced more problems in the students. In this regard, most challenges were due to the non-attendance of the students and teachers in the schools. The emergence of online teaching platforms replacing classrooms was also a challenge. Face-to-face teaching has been eliminated temporarily, and teachers remain unaware of most of the children's behavior problems. And also, underprivileged students face financial problem in buying some devices such as tablets and smartphones. For continuance of care, we changed the mode of intervention in the pilot implementation of a school mental health program as follow: online training of teachers, phone-based interventions, providing online information packages, and telephone follow-up. Please, next slide. And next, I don't have enough time, and the last slide, this is the last slide. Okay, after using these changes, we had some achievement in these adaptive activities, such as increased sensitivity of school staff on mental health issue, because mental health became an important topic on top of the mind of school principals and other staff. Increase awareness of parents towards mental health issue of children. Parents started to speak about mental health problem of their children and receive consultation. Indeed, raising parents' awareness reinforced their help-seeking behaviors, and identification of students with mental problems or mental disorders we faced, because it caused a percent of the cases identified in schools to be having mental problems or complaint were able to receive psychological and psychiatric services. At the end of my presentation, I would like to thank a UNICEF representative in Islamic Republic of Iran for its support, and there is a very good collaboration between UNICEF representative in Iran and all of the related stakeholders. Thank you so much.
Thank you, Dr. Hajabi, and thank you so much for sharing the details of your experience in Iran. Especially, I appreciate, the results of your policies that you highlighted at the end. So let's move. We're going now to another part of the world, and this is we're going to go now to Dr. Liliana Encisa. She will make her presentation in Spanish, so you can have access to the English channel. La doctora Encisa trabaja en el programa de salud de Adolescente de la provincia.
El Chaco Adolescent Health Program in Argentina, in the province of El Chaco. It's a province that I know really well. And she will share with us some of her experiences in her province regarding this topic. Please remember that you can click on the interpretation button to listen to the interpretation into English. Dr. Encisa, you have 15 minutes, and I will remind you when you have 5 minutes left. Dr. Encisa, thank you very much, and thank you for the space to share here with you. It is a pleasure to be able to share with you the lessons learned and the experiences in the province of El Chaco, the intersectoral approach and the impact and the work we did in the case of impact of suicide in adolescents. The percentage of deaths due to external causes in Argentina says that that the second cause of death in adolescents between 10 and 19 years of age is suicide in Argentina. And the province of El Chaco, this is also true, and it affects mostly males. The death rate is 16.4 per 100,000, and in El Chaco, it's 4.2. We will see in particular that this is a province in the north of Argentina where specifically we see the locality where we have been working, where we have indigenous populations mostly, and there is a large population of different indigenous group. So we have the ASPO, which is the acronym in Spanish, meaning mandatory preventive social isolation. And this was implemented in Argentina back in March 2020. And it was to prioritize the care of patients suspected of contracting COVID-19. And there were 2 suicides in a couple, a male and female, a girl who was not indigenous, and a young man who was from the indigenous population. This was a big impact in the community, and the press managed this with great sensationalism, and this was a shock for our community in the town of Miraflores, which is small, 8,000 inhabitants. So because of the mandatory social distances and isolation, we had very many marked restrictions. Classes were suspended. This generated a negative impact on communication with adolescents on regarding daily nutrition, education, loss of schools, ability to convene. And also there was a difficulty by the teachers to maintain communication with the students. They also didn't have their physical activities. They didn't have communication with the different ethnic languages. So what were the responses by the government? First of all, there was an interministerial working group established with different sectors: health, education, rights protection organizations, justice, human rights, and also the groups that protect the rights of boys, girls, and adolescents. We were able to establish a working dynamic based on this group. Given that children weren't being able to go to class, also many of them live in remote locations and they have no internet connection in many cases. And this makes difficult any access by the adolescents. There were other suicide attempts. There was a great deal of anguish and anxiety given the context. And also in these very remote locations, mental health services do not exist in the locations themselves. In addition, there is also the issue of interculturality and the fact that the different indigenous groups speak their own languages, and interpreters are essential to work with some of these indigenous populations, and they are not always available. So next, on the one hand, centralized responses were established. This is a very important issue to be able to generate an organization in such a large territory. So we established meetings with 8 months of follow-up with community leaders. We had meetings weekly, and the meetings would last 1.5 hours. And also our purpose was to take care of the caretakers. We had to obtain consent. We had to also obtain participation from the whole community, especially led by the teachers. So we needed to have a community engagement. We also did a joint mapping of training spaces for the treatment of the situation. And we worked with Adolescent to the extent that the mandatory isolation policy allowed it. And also there was training giving on myths and prejudices relating to suicide. And we received help from experts from other provinces, neighboring provinces of the country, who were able to provide their knowledge and generate more community engagement. We worked with the teachers. I repeat, as long as isolation measures were respected. Teenagers worked in preparing a form of communication. They made a video which used the two languages, Spanish and Com language. We also established emergency devices, and this is for the communities because they didn't have mental health services that could be provided. So we had comprehensive adolescent health advisor with a community engagement as well. The plan is called ENIA. We also had interpreters, community interpreters, who made sure that all the Com language people could understand. And we had bi-weekly attendance of the population's mental health requirements in person, but whenever they couldn't attend, then they could be supported remotely. And we kept on listening to the community. The highlights of the achievements and what is the progress we've had to date. So we were able to establish the subjective risks among the adolescents. So there was the subjective urgency that needed to be established in times of pandemic when there would be self-harm and suicide attempts in adolescent. We need risk assessment within the pandemic, and we had the dialogue through the work that we did, which was through the ad hoc group to develop strategies and factors for community resilience. And again, we took into account multilingualism and the language interpretation for the Com language speakers. So we established an intersectoral program. We had centralized responses, but we developed tools to work on prevention, on care, and in post care. So what were the lessons learned from the different tools we used, and both the centralized work and the contingency emergency approaches? We were able to create a set of criteria for centralized responses, doing interventions and having follow-up, then developing emergency tools and forms of help. Also, we had ongoing evaluation. We had training based on gender rights and interculturality. And we also had a radio program in Com language. And the program was called Our Hope. And here they could speak about their weekly problems, talking among the community, having question and answers, having interviews with key people, not only from the community, but also guests from outside the community and some experts who came and supported and provide help during the situation. So these were the kinds of tools that we have developed that were community-centered for communication. So the experiences of South-South cooperation and learning with other countries were very important. This was very pertinent, and there was a collaboration between El Chaco province and UNICEF, and an official document was prepared for the province. And so it included the recommendations that emerged from the program. And we can talk about three major aspects: continue with evidence-based work, with permanent training, transdisciplinary approaches with engagement by the community, determining contingencies of emergency throughout the territory, and support for everyone. And this is with a view to follow up always. Thank you very much. Thank you very much, Dr. Enciso, for your presentation and for sharing your experience in the province of El Chaco in Argentina. Now I'm going to switch back to English.
So we continue, and now this time we're going to travel to China. And I am very pleased to introduce to you Mr. Su Yanong, who joined the Youth League Committee of Education Bureau district in Beijing in 1989, and since then has quite a very interesting trajectory, which will make his presentation very appealing to us. So without further ado, I will give the floor to Mr. Su Yanong. He will be speaking in Chinese, and we can listen to the interpretation by clicking the icon on interpretation on your screen. Over to you.
尊敬的 Address Franco 夫人，各位专家，大家好。
Good morning, good evening.
大家好，作为一名中国的青少年
As an adolescent mental health worker in China. Hello.
大家好，作为一名
As a
大家好，作为一名中国的青少年心理工作者，
adolescent mental health worker in China, it is a great honor
非常高兴能和各国的专家
to participate in today's conference
和各国
together
交流分享我们
with
在
experts from various countries.
在青少年心理方
But I
面开
hope through my presentation I'll be
希
able
望
to
能够
share
为
with
持
experts
续抗击疫
and
情，
practitioners
保护
from
青少
different
年
countries
成长，
the experience working on youth mental health during the pandemic, promoting changes and play an active role in sustaining the fight against the pandemic and
除了对人
protecting
的身
healthy
体造成伤
growth
害，
of youth.
同时也对人的
The
心理。
COVID pandemic is becoming an enemy of the whole world. In addition to
青少年作为
causing
处
physical
于
harm, it
成
also
长
has
的
a huge
社会，
impact on people's mental health.
新冠肺炎
Teenagers are a
青
growing
少年
social group,
心理产生的影响，
and the
较
impact
对成年人的影响
of the COVID on
根据中国
adolescent
教
mental
育
health is greater than
2020
that on the
公
adults.
布的数据，
According to data released by the Chinese Ministry of Education in August 2020,
尽量消
China
除减
has
轻
213,000 compulsory education schools
是青少年工作者的责任。
1.54 million students. It is the responsibility of us adolescent mental health workers to reduce the adverse effect of the pandemic on adolescents.
健康法律服务
My organization, Beijing Youth Legal and Mental Counseling Service Center, has long been engaged in youth mental health, legal services, safety, and self-care, drug control and HIV prevention. In 2020, under the guidance and support of the Youth Vice Department of China Youth League and the Central Committee, UNICEF and others, between February and June 2020, 100,000 youth across the country and 18,000 elementary and middle school students in Beijing underwent survey on their mental conditions. And according to the results of the two surveys, it can be seen that mental problems common to teenagers during the pandemic include these following. First, look at mental state of adolescents. Due to the pandemic, adolescents have stress reactions such as fear, nervousness, and worry about the disease, and emotional problems represented by anxiety. Sources of negative emotions are pressure from exams, study, and not being able to see friends, or being lonely. And looking at internet usage of young people, their time spent on internet by primary and middle school students increased during the home study period. Some teenagers have conflict with their family members because of playing mobile games and phones, and some students with weak self-discipline will use school online class for online entertainment, resulting in even lower learning efficiency. And from the perspective of mental health seeking methods, during the pandemic period, nearly 90% of lower grade students are more inclined to ask for their parents for help, as the mental counseling methods of senior students are more diverse. In addition to confiding to their parents, they also obtain mental support through communication with classmates, teachers, and through the internet. Many parents lack effective family education and are eager for professional guidance. In response to the mental problem of young people during the pandemic, our institution organized mental health experts and counselors to carry out systematic adolescent mental health promotion action based on the following four goals. First, we made it possible for more young people to acquire mental health knowledge through their favorite channels to improve the overall mental health of young people during the pandemic. We established a team of mental counselors so that teenagers can, with such need, can get one-on-one mental counseling in a timely manner. And thirdly, we provide professional assistance to mental health workers in areas severely impacted by the COVID outbreaks. And fourth, we conducted investigations and researches on the mental state of young people and provide technical support for government decision making. And in order to achieve these goals, our organization has carried out the following tasks. First, we rolled out. We carried out a questionnaire last year. And based on the questionnaire, we gathered a general situation of youth mental health. And the results were shared with the central government. Also rolled out many mental health products during the pandemic. And we, in collaboration with the Youth League and UNICEF, we made videos and other materials to give adolescents methods to deal with pressure during the pandemic. Also, the material was published on the Youth League's official WeChat accounts and other government official accounts, covering more than 10 million Chinese youth. At the same time, during the most severe period of the pandemic in China, voices from 1, 2, 3, 5, 5, 100 questions and answers on youth mental counseling was published. And the copies were given to mental counselors at the 1, 2, 3, 5, 5 youth help desk in 20 provinces across the country for free. And we also provided one-on-one mental counseling for teenagers with mental problems through internet and telephone. And from January 25th to July 1st, 2020, our center organized 9 mental health experts to provide individual counseling to teenagers through 12355 Youth Mental Counseling Network platform from 8 to 24 o'clock every day. The highest daily consultation numbers reached 200. According to the statistics. And during last year, 269 12355 youth help desks across the country provided more than 1 million times mental service to teenagers and their parents through the internet and telephone. And mental health workers at the youth help desk in Wuhan also broadcasted mental knowledge to COVID patients in a temporary shelter hospital.
第4点就是积极共享疫
And we
情
also actively share experience in mental assistance
为湖北等
for
省
the
心
pandemic
理工作
and
者。
provide theoretical and practical guidance for professional mental health workers in
2020年
other
3月，
provinces.
我机
In
构为湖
March
北
2020,
100
our center provided
社
more
工
than
志愿者提供了疫
100
情之下
social workers
常
and
见心理
volunteers
问
in
题的
Hubei
心理
province
知识和技
with
能的培训，
mental assistance knowledge
受到武
and
汉
skills
警方
training
和社工的
for
高度评价。
common mental problems under the
去年
pandemic.
4月，
The training
研
was
发了
remarkable and it was highly
特定青少年群体
spoken
心理
of by
工具包
Wuhan。 organizers and social
该工具
workers.
包为青少年心理工作者
Our center
和社会工作者
and related mental health workers in Hubei and Beijing jointly developed a mental counseling
心理工作
toolkit
者具有
for
指导意义。
specific groups of young people under the pandemic. The toolkit provides detailed methods for identifying and intervening
那么
mental
作为
health
一
problems
家
for young
心理专业机
mental
构，
health workers and social workers.
我们主要的工作经验如下：第一，就是疫情期
Our
间
main work
青少年的
experience
心理工作
include the following.
要与政府疫情防控的各项工作紧密配合，才能发挥积极
during
的
the
应用作用。
pandemic, our work
中国
must
的
in
疫情
close
防控工作
coordination with
取得
the
了令人
government
世人瞩目的成绩。
government
成功的
pandemic
主要原
prevention
因
control work.
在于中国共产党的领导和政府科学、全面、有效的工作部署，以及全国人民的共同努力。
China's
作为专业心理机构，
pandemic
机构
prevention control work has been
共同
largely successful so
为这样
far. One of the main reasons is the scientific, comprehensive, effective deployment by the party and the
以
government,
数据
as
为
well
基
as
础，
the joint efforts of the people across the country. So as a professional mental health institution, our center closely cooperated with government departments such as the Youth League, the Health Commission, and the Civil Affairs
机构
Ministry.
就在平
The
时
work is targeted and avoiding any blind spots in our work and maximize the role of professional institutions. And
对于专业机构来说
secondly, professional mental health institutions
不仅是
can
应急
only
管理，
develop and play their role in time of emergency if they strengthen themselves
专业
in
机构
normal
平
times.
时呢，
So for
专业训练
our professional organizations,
专业
social
督导
emergencies test
专业
not
机构
only our emergency management capacity, but also our professional
第
technical
三个就是
capacity accumulated in
学校
normal
平时的
times.
心理健康教育
Therefore, the
对
training, practice, and
青少年
supervision of professional organizations are
具
very
有
important.
重要的作用。
And regular school
根据去年2月份
mental
的调
health
查，
education plays an important role in
青少年认为
stabilizing the mental
疫情
state
对
of
自己没有
adolescents
影
during the
响，
pandemic.
可有一定影
According to
响
a，
但没
survey
有影响到
conducted
正
in
常生活。
February last year,
但
adolescents who
团体
believed
调查对
that the
象呢，
pandemic had no impact on them or had limited impact
认
on
为
their
有
life
心理影响，
accounted up
或
to
会行动做好，
66.7% of all survey responded. This is in
这
line
些
with
呢都
the
与近年来中国各地
general
教
priority on mental health education
普遍
in
重
schools
视心理健
at
康教
all
育。
levels in recent years in China.
疫情期间，青少
And
年
during the pandemic,
良
the
好的
good
心理素
health
质
meant good
和
mental
抗压
health
能力
quality and
也
stress
成为促进社会稳定的
resistance
重要的。
demonstrated by the youth have also become an important
在
factor
取得
in
成功经验
promoting
的基
social
础上，
stability.
由于新冠疫情具有突然性，
On the basis of successful
社会
experience, due to
在
the
抗击新
suddenness,
冠疫情的
uncertainty,
过
and
程中，
social nature of the
青少年心理
pandemic,
工作
when
也
fighting
存
the
在一些
pandemic,
短板。
there are still
主要包括
many weaknesses and shortcomings.
学校的心理健康教育中还缺乏对青少年进行突发事件
Shortcomings in the mental health work of young people,
心理
including,
应对、
for example, in the school's mental health
心理调
education,
试技能
there
的
is still a
教育，
lack of education for young
导
people's
致
mental
部分青少年出现
response
心理
and
问题。
mental adjustment skills
第二
after
呢，就是
emergencies,
青少年居
which
家
has
学习
caused
期
some
间，
young people to
部
have
分学
certain
生
mental
网络使
problems.
用
And during
专
teenagers'
业
stay-at-home
心理
study
工作
period,
者
some
缺乏对
teenagers
青少
use
年及家长
internet
提供有
excessively,
效的
and
生活
professional mental
及
health workers lack effective study-life balance advice
第
for
三呢，就是
teenagers and their
青
parents.
少年专业心理机构、
Thirdly,
心理工作者
during the
缺
pandemic,
乏与世界其他
professional
国家的
adolescent mental
交流工
institutions
作、
and mental health
分享
workers
经验的
lack
平台。
platform to share work
以上是我
experience
作为一名青少年心
with
理
their
工作者，
counterparts in
就
other
疫
countries
情
around the world.
期间开展
So
青少
all
年
this
心理
above has been
工作的
some
一
of
些
my
基本
personal
的
experience
情
as
况和
youth
工作
mental health
会。
worker
目
on the
前
development of
新
youth
冠疫
health
情仍然在
during
全
pandemic.
球流
At the
行，
present, the
我们期待
pandemic
世界
is
卫生
still
组织
serious
以
globally. We
联合
expect
联合国儿童
international
会
organizations
等
such
国际
as
组织
WHO
都在
and
以下方
UNICEF
面
to play
为
an
青少
active
年的心
role
理
in
健
the
康工
mental
作
health
发
of
挥
young
积极作
people
用。
in the following areas.
第一呢，就是希
We
望全球
hope first
都像
that
重视
international
生理
organizations
健康一样，
can
重视青少
attach
年的心理健
importance
康，
to
充
mental
分
health
发
of
挥
young
专家
people
优势
as
和
much
意
as
识形态的优
they
势，
attach importance to
为
their
全
physical
球的
health
青少年心理
and
工作者
give full play
主
to their own advantages
经
and
验。
provide technical support
第二个
and
呢，
successful
我们认为
experience
青少年
for
是
us
人类的未
young
来，
mental health workers
从
around
长
the
远来
world.
看，减
And
轻
youth
生
is the
青少
future
年
of the
和
mankind.
焦
In
虑
the long run,
问题仍然
alleviating
是
mental
上
problems such as
尤其是
loneliness
在
and
新冠疫
anxiety
情
among young
在
people is
全
still
球
a
蔓延
challenge,
的背景下，
especially in the
对
context of
青
a
少年
global
心理健康
pandemic.
进行投
It
资，
is urgent to invest
迫切
in young people's
需要
mental
资
health
金充足的计
and
划
requires
来支
this
持学
requires
校、家庭
well-funded
和
programs
社区
to support
开展
schools,
青少年心理健康，
families, and communities to
使
carry
青少
out
年
mental
及
health
时获
work
得
for
信
young
息
people,
来
so
解
that
决。
young people can obtain timely information and
各
services
位
to
专家，
solve their mental needs.
中国国家
Dear
主席
experts,
习近平
like the President of
人类
China,
命运
Mr.
共
Xi,
同体的
was
价值观，
put forward the
因凝聚
initiative of
全球力
building a
量，
community
共
with
同
shared
抗击
future for
新冠疫情
mankind.
有重要的指导。
This is
青少年
has
心理工作是
important
抗击
guiding
新冠
value for gathering
重
global
要的
forces to jointly fight the COVID
期待
pandemic.
全球青
Youth
少年
mental
心
work
理
is an
工作者
important part of the
共同携
fight,
手，
and we are
为抗击
confident
新
that
冠疫
youth
情、
mental health workers from all
促
over
进
the
青
world
少年
will work
健康
together
发
to
展
make positive
做出积极
contributions to the fight
谢谢大家。
against COVID and promote development and adolescent mental health. Thank you all.
Thank you very much, and for the presentation, the examples, much appreciated. So I think we have some time for questions, and I encourage you to place your questions by clicking on the question and answer box, and we will try to take it back to the panelists. So I have a couple of questions that have come up, and what I'm going to do to the panelists is I am going to present the questions slowly to all of you, and then I will give you a couple of minutes to address the question that you feel is more pertinent to you. So the first question that is coming is on the definition of mental health. How do you actually make this definition, if it's with one question or more than one question? And I think there could be, it would be interesting to hear from countries as well. The second question is how can we make sure that we are reaching the hardest to reach children? You know, and then of course this can also be a
就是
different
青少年在
experience, like
中国的
we
定
heard
义，基本
from
上就
China.
是
We still have the Chinese microphone open. Thank you very much. So the second question is your own thoughts on how can we reach the most vulnerable children, for example, children that are out of school. So any ideas on how to reach the hardest to reach are very welcome. Some of the answers have been typed as well in the question and answer, but some reflections are useful. A third question is on the helplines. So in the case of Dr. Hajabi, you made a reference to the helpline. In our last presentation from Dr. Xu Jianyong, we also heard about the service help desk. And the question is your reflections on how these helplines are being effective in addressing issues of mental health. So let me go with these three questions back to the panelists, and we can take it from there. So I'm just going to go quickly through the panelists to see what their reflections are. And then after that, we will see if there are more questions and answers and continue with our final one. So I'm going to go exactly in the order of the presentations that we heard. So I will begin first with Dr. Fatima for your initial reflections. A couple of minutes, Dr. Fatima.
Thank you, Dr. Andres. So let's just start with the definition of mental health. So we know that what WHO says that any illness or mental health is not just absence of disease. So how we look at mental health is about the individual being comfortable with oneself and being able to realize one's potential. So it includes emotional health, sociological health, environmental health. So it includes a person's ability to utilize one's own potential, feel comfortable with oneself, and being able to enjoy life, being able to pursue goals. So it's not just not having depression or not just having anxiety, but able to use the resources and the potentials a person has and the environment that the society offers to use it for the betterment of society and for the betterment of oneself. So it's kind of a broad application. The second question was related to how we can reach hard to reach population. It's a very important question, and it's as you say, it's hard to reach population. So because we know that school-based children, we reach to the schools and we find them and we work with them. But the children who are not in the schools and other vulnerable children, we need to work through community-based societies, NGOs, societies which are working in the communities. So any organizations, any community-based activities that are happening through that, we usually work because they usually are able to reach better who are locally working within the communities, and they are able to better reach. And we sometimes need to develop and provide platform for these children where they could come and spend some time, have some social activities. So engaging them through sports-based activities or some other recreational activities. So where we can gather them and reach them and provide them some psychoeducation or other information or services to develop their social emotional health, etc., while developing their skills. So that is important. Yes, they are hard to reach, but it's not impossible to reach. Another hard to reach or difficult population which really needs our support is the increasing number of migrant population or children in emergencies and humanitarian conflict. The numbers are increasing day by day, and these children are even more in need because they are, a lot of them are traumatized already. So their mental health is really at risk. So we need to reach them through the organizations which are working with them already. So we engage with those organizations, and through them we reach them and provide them the services that is possible for us to provide. Can you repeat your third question? I'm sorry, I'm missing that.
No, the last question was on the helplines, but I think that is more referred to the country experiences.
Right, right. Thank
Unless
you.
You want to make a comment to it, please go ahead.
Yeah, I mean, helplines are definitely helpful for a lot of people, especially those who are not able to, go to the clinics and services, and they don't know where to go. So helplines, and especially in the kind of emergencies, specifically for people who are really in the high stress, are suicidal, etc. So these helplines are really life-saving in a lot of cases of abuse. So there are a lot of case studies and evidence available that shows really good utility of these services. So I would really encourage countries to provide services where possible. Thank you.
Okay, thank you. So let's go to Dr. Hajabi. And Dr. Hajabi, maybe you can comment, you can make a comment, of course, on the helpline. And it would be, there's also a question in the chat, which is, what is the impact of the adolescent mental health on the economies? And maybe you can say something in the context of COVID-19, in the context of Iran. So Dr. Hajabi, some comments from you?
Thank you. First off, I would like to explain some key points about the helpline. Helpline, about 3 weeks after the beginning of COVID-19 pandemic, we started to design a helpline with a 4-digit helpline 4030 for better access for all of the people. We try to train some clinical psychologists. We selected the clinical psychologists who had enough experiences for providing counseling for in their experiences in the past, and we selected them. We trained this counselor with some specific packages that we had the more frequent complaint from the clients, the callers. But when we go ahead, we could promote our services, because our services was dynamic, and we change our services based on the requests and requests of the callers. And during the time after 2 or 3 months, we could settle down the most of the complaints. We could answer to most of the complaints of the callers after about 2 months. And we had the change from anxiety and stress to depression during the time after 2 months, because at the first, most of the people face a vague and ambiguous phenomenon. And as you know, this kind of concern causes anxiety and stress. After 2 or 3 months, most of the people had complained about their depression, because they had concern about the financial problems. In 2 or 3 months, we had in some days more than 10,000 contact with the helpline. And I think it was a very good experiences. And after 6 months, we had an evaluation on the effectiveness and satisfaction of the callers to the helpline. It was a qualitative research, and we did this research, and we could get some results, and based on these results, we could change our services based on the request of the callers.
Thank you very much, Dr. Hajabi, for your answers to this question. Let me move quickly to Dr. Encisa. I think because of the characteristics of El Chaco, maybe you can also address the question of reaching the unreachable children. And then I will move quickly to Dr. Su Yanong. There's a specific question for him. We have about 4 minutes, so I will encourage you, Dr. Encisa, to be very succinct. Dr. Encisa, tiene la palabra.
Thank you very much. When we work with multiple sectors, we can get to know those organizations that are in remote areas and that are also familiar with the population, and they always organize in one way or the other. So it is important to respect the organizational dynamics of the population and have clear contact points within the territory so that we can actually reach out to those adolescents that are the most vulnerable. Let me offer an example. We were unable, because of communication issues, because these individuals did not have cell phones, we couldn't reach to them, but the teachers were familiar with that group of adolescents, with more than 200 of them who lived in rural areas, and they were able to reach out to those adolescents that were in remote areas, and they were also able to offer counseling, to have a dialogue. And that was extremely useful to later on create information that we then took to our weekly discussion tables. So we need to supplement working tables so that in turn we can have those that are in far remote areas to see that they always have a help context and that we can always generate new strategies based on their own needs. Excellent. Thank you very much for the answer.
Question for Mr. Xu. And there's a question about the mental health support services for students in school. Just because students are back in school. And the question is there any extension of the ad hoc mental health support network after the pandemic? So I will give you the floor and you have a couple of minutes. So Dr. Xu?
好，大家好，
Thank you very much, and thank you for the succinct summary. Colleagues, we're coming to an end, and I think we should now give the floor to our wrap-up speaker. We will, of course, answer other questions in writing to colleagues. I think we cover them most, but those that we didn't, we will make sure that we answer them properly. I am very pleased to introduce Dr. Alsem Hennis, who is the director of the Department of Non-Communicable Diseases and Mental Health at PAHO. So Dr. Hennis, you have the floor for a final wrap up, and I think we're totally on time, which is actually very good. So you can wrap up.
Thank you so much, Andres Franco. Thank you, and I will keep to time. I would like to thank UNICEF for organizing this important exchange, in addition to WHO, the International Policy Center for Inclusive Growth, and also for the colleagues who shared their country experiences from Iran, Dr. Hajabi, Argentina, Dr. Encisa, and from China, Mr. Jiangnong, and for sharing their invaluable experiences. Now, as we have heard, child and adolescent mental health is an issue of critical importance in the region of the Americas, as it is in the entire world. Adolescents and youth make up a sizable 30% of the population of Latin America and the Caribbean, yet mental health services for this group remains neglected. Depression and anxiety are among the 6 leading causes of years of life loss due to disability among young people in the Latin American and Caribbean sub-region. And alcohol and substance use is one of the leading risk factors for disability. In recent years, the overall adolescent mortality rate in the region has increased, with suicide being among the leading causes. And in fact, suicide is the 3rd highest cause of death among young people aged between 20 and 24 years of age in Latin America and the Caribbean. Despite the high burden of child and adolescent mental health problems, financial and human resources for child and adolescent mental health are lacking in the Americas. Only around 50% of PAHO countries and territories report having a plan or strategy for child and or adolescent mental health, and community and school-based mental health services for children and adolescents are woefully inadequate. The COVID-19 pandemic has had serious adverse impacts on the mental health and well-being of many people worldwide and in the Americas, as we have heard. We've learned about the impact of disruptions to services. We learned about the immediate impacts in terms of psychological distress, anxiety, and depression, among others. And we also heard about the potential for future consequences, and of course, the vast gap in terms of servicing needs. High rates of stress, depression, and anxiety have been documented in numerous countries globally, as well as in the region of the Americas. But children and adolescents in particular, for whom this time in their lives is characterized by significant physical, cognitive, and social and emotional growth and development, have suffered in unique and profound ways. Large gaps in learning, healthcare, and socialization, combined with added risk factors for instability and conflict at home, including higher likelihood of domestic violence, make the mental health of children and adolescents precarious. Studies from the region of the Americas demonstrate the current mental health struggles that young people are experiencing. For example, a 2020 UNICEF poll of more than 8,000 adolescents and young people in Latin America and the Caribbean found that 27% reported feeling anxiety and depression in the previous 7 days. While the longer-term effects of the pandemic on mental health remain to be seen, it is likely that even after the COVID-19 pandemic is behind us, we will be coping with its repercussions on child and adolescent mental health for years to come. Countries are taking action to address the increased demand for mental health and substance use services during the pandemic, but they continue to face barriers, particularly related to disruptions in service provision. For example, 62% of countries in the Americas reported disruptions to services for children and adolescents with mental health conditions or disabilities, and 70% reported disruptions to school mental health programs. South-South cooperation is an essential tool to effectively and sustainably address shared health challenges, achieve common targets, and tackle issues of health equity within and across our countries. It represents an important opportunity to advance mental health, and more specifically, child and adolescent health, an area which has historically been neglected by traditional development assistance for health. Now, more than ever, we must continue to advocate for and strengthen South-South cooperation among our countries in order to meet the increased need for mental health services for children and adolescents during and after the pandemic. We can also support each other in building back stronger and more resilient mental health systems for future crises and threats to child and adolescent mental health, such as climate change. PAHO is committed to facilitating and fostering South-South cooperation in child and adolescent mental health across sectors and entities. As part of the UNICEF and WHO joint program, PAHO and UNICEF are currently exploring opportunities to collaborate in the mental health and psychosocial support, well-being and development of children and adolescents in the Americas. This work builds upon recent joint actions on the topic, among them the development of school mental health literacy curriculum for primary school teachers, a virtual course in mental health literacy for high school teachers, joint webinars, as well as youth hangout sessions, and the My Formula campaign, where youth talk about their formula for managing COVID-19. A promising project with PAHO Colombia and UNICEF will pilot a minimum mental health and psychosocial support package in humanitarian context, which includes intervention for child and adolescents. The COVID-19 pandemic poses unprecedented threats to mental health and well-being of children and adolescents. If we do not collectively address this crisis now, we risk our youth becoming a lost generation, held back by the long-term impacts of the pandemic on their education, physical health and mental health, and future economic and social opportunities. Together, we must work together and learn from each other to ensure that all young people make it through this pandemic safely through South-to-South collaboration, and that future generations recover and are healthy and resilient. Thank you so much.
Thank you so much for those concluding remarks, which really bring full circle to the tour we've been going through. So much appreciated. I think just from my perspective, a couple of thoughts. One is that this really tells a story about how, from country to country, some of the opportunities and the challenges to address mental health issues in adolescents have a number of similarities. And this just provides the justification for more events like the one we've done today, where we can compare and where we can learn from experiences, from failures, from things that we can do differently across countries. Adolescents are adolescents wherever you put them. It doesn't matter where they are. And the way of working with them, we can learn from country to country. I also think that just having our colleagues from WHO and PAHO provide this overall picture really puts the right framework for the country by country experiences that we got. So I really want to thank all of you for having participated today. Thank you so much to the organizers and the partners who brought us together. You will receive a survey after the webinar. Just take a couple of minutes and tell us how we did and how we can do it differently to make sure that these are really, truly learning experiences for all. So on behalf of all colleagues, I just want to wish you a fantastic rest of the day. And thank you so much for your participation today. Very much thank you to the interpreters who did a fantastic job. It's always hard, but well done.